RFK Jr. to oust entire health panel on cancer screenings, citing woke agenda. Imagine a healthcare system where life-saving cancer screenings and HIV prevention measures are no longer covered by insurance, leaving millions of people vulnerable to devastating diseases. This alarming scenario could soon become a reality, as Health and Human Services Secretary Robert F. Kennedy Jr. is reportedly planning to dismantle the advisory panel responsible for determining which preventive health measures insurers must cover. But here's where it gets controversial. Kennedy's decision to oust the entire 16-member U.S. Preventive Services Task Force is allegedly motivated by his perception that the panel is too woke. This raises important questions about the role of politics in healthcare decision-making and the potential consequences for public health. The U.S. Preventive Services Task Force plays a critical role in evaluating scientific evidence and making recommendations on preventive care, including cancer screenings and HIV prevention drugs. By dismissing the entire panel, Kennedy would be effectively stripping away a crucial layer of expertise and oversight, potentially leaving insurers to make decisions about coverage without adequate guidance. And this is the part most people miss. The removal of the panel could have far-reaching implications for the health and well-being of millions of Americans, particularly those who rely on insurance coverage for preventive care. As the news of Kennedy's plan spreads, many are left wondering what this means for the future of healthcare in the United States. Will the dismissal of the panel lead to a decline in preventive care coverage? And what will be the consequences for public health? These are questions that demand answers, and it's essential to consider the potential impact of this decision on vulnerable populations. But what do you think? Should politics play a role in healthcare decision-making? Or should expert panels like the U.S. Preventive Services Task Force be allowed to make recommendations based solely on scientific evidence? Share your thoughts in the comments below. As we delve deeper into this controversy, it's crucial to examine the potential motivations behind Kennedy's decision and the potential consequences for the healthcare system as a whole. By exploring the intricacies of this issue, we can gain a deeper understanding of the complex interplay between politics, healthcare, and public policy. So let's dive in and explore the implications of this decision and what it might mean for the future of healthcare in America. One thing is certain: the removal of the U.S. Preventive Services Task Force would be a significant shift in the way healthcare decisions are made, and it's essential to consider the potential consequences before it's too late. As the debate unfolds, we'll be keeping a close eye on developments and exploring the various perspectives on this critical issue. In the meantime, we want to hear from you. What do you think about Kennedy's plan to oust the advisory panel, and how do you think it will impact the healthcare system? Join the conversation and share your thoughts. AMA raises concern over USPSTF changes protecting preventive healthcare. Imagine a scenario where a key group responsible for ensuring that preventive healthcare services are accessible to everyone could be dismantled. That's exactly what has the American Medical Association, AMA, worried. Chicago, the AMA has sent a formal letter to U.S. Health and Human Services Secretary Robert F. Kennedy, expressing profound concern over reports that he plans to dismiss all members of the United States Preventive Services Task Force, USPSTF. The USPSTF is vital because it provides unbiased guidance to doctors on how to prevent diseases and enhance patient health. The AMA stated in their correspondence, "We strongly advise against replacing the current team and instead maintaining the established routine of regular meetings to keep their crucial work uninterrupted." The full text of the letter can be accessed here, https://maassn.org/letter, document download /URI/2025-727, letter to Kennedy USPSTF, PDF. In the letter, the AMA explains that the USPSTF has been instrumental in formulating evidence-based guidelines for disease prevention. Members are chosen through a transparent nomination process and are respected experts in primary care, prevention, and evidence-based medicine. They volunteer their time to promote better health outcomes across the nation, aligning with the goal of improving public health. One of the USPSTF's most significant contributions is shaping health insurance coverage policies. Federal law mandates that insurers cover services recommended by the USPSTF without charging patients extra fees. This includes essential screenings for cancers like colon, breast, and lung, mental health evaluations for children, and preventive measures for heart disease. Such no-cost access is crucial for maintaining overall public health and minimizing the impact of diseases. Doctors' primary duty is to enhance patient health, and the USPSTF supports this mission by evaluating the pros and cons of various preventive measures and offering science-backed advice for their use in primary care. Therefore, the AMA urges Secretary Kennedy to preserve the existing USPSTF membership and uphold the task force's regular meeting schedule to ensure timely updates and distribution of their recommendations. But here's where it gets controversial. Could removing the current USPSTF members disrupt the continuity of their valuable work? What do you think? Share your thoughts in the comments below. RFK Jr.'s plan to remove USPSTF members sparks concerns. A storm is brewing in the world of preventive healthcare, sparked by RFK Jr.'s rumored plans to overhaul the U.S. Preventive Services Task Force. This move has sent shockwaves through the medical community, raising eyebrows and deep concerns among professionals who see the potential for significant harm to public health. According to reports, Health and Human Services Secretary Robert F. Kennedy Jr. might be contemplating a major shakeup of the U.S. Preventive Services Task Force, USPSTF, a panel of independent medical experts tasked with providing recommendations that guide insurance companies and doctors in deciding on preventive health measures. These measures include crucial screenings for conditions like cancer and diabetes, as well as the use of HIV and cholesterol medications. The American Medical Association, AMA, the largest association of physicians in the U.S., has stepped forward to express its deep concern over these developments. In a letter addressed to Kennedy, the AMA urged him to retain the current members of the USPSTF, emphasizing the panel's critical role in ensuring access to evidence-based preventive services. The AMA fears that any disruption to the USPSTF's work could lead to a halt in progress towards improving public health. Doctors across the country have echoed the AMA's worries. Infectious disease specialist Dr. Shelley Kahn described herself as deeply alarmed by the potential changes. She highlighted the importance of the current members' expertise and the impact of their recommendations on preventive care discussions with patients. Dr. Kahn is particularly concerned about the effect on the availability of safe and effective HIV prevention medications. Dr. Thomas Liu, an assistant clinical professor of medicine at Stanford University School of Medicine and a hospital medicine physician at Stanford Healthcare Tri-Valley, shares similar sentiments. He believes that altering the USPSTF's composition could undermine the strides made in preventive care, potentially leading to higher healthcare costs and sicker patients. This is the opposite of making America healthy, he lamented. An HHS spokesperson responded to the controversy, stating that no final decision has been made regarding the USPSTF's future. However, the potential for change has raised questions about the politicization of preventive healthcare and the integrity of scientific guidelines. Established over 4 decades ago, the USPSTF's influence expanded significantly after the Affordable Care Act's passage in 2010. The legislation mandated that health insurers cover preventive services recommended by the task force without imposing additional costs on patients. The USPSTF's structure was recently upheld by the Supreme Court, though its members were deemed inferior officers subject to removal by the HHS Secretary. Nonprofit organizations warned that removing cost-sharing for essential services like breast cancer screenings and HIV prevention drugs could discourage patients from seeking medical care. Kennedy's recent actions have fueled speculation about his intentions for the USPSTF. Last month he dismissed all 17 members of the Advisory Committee for Immunization Practice, ACIP, another government panel responsible for vaccine recommendations. He subsequently appointed 8 new advisors, some with a history of vaccine skepticism. Additionally, Kennedy has discussed plans to disrupt the medical journal system, aiming to create new journals and cease publishing NIH-funded research in traditional outlets, citing concerns about pharmaceutical industry influence. As the situation unfolds, the medical community and public await clarity on the future of preventive healthcare in the U.S. Will the USPSTF remain a bastion of evidence-based medicine, or will it fall prey to political maneuvering? And this is the part most people miss. How will these changes affect the everyday person seeking preventive care? We invite you to share your thoughts in the comments section below. Do you believe that the USPSTF's independence is crucial for maintaining the quality of preventive healthcare in America? Or do you think that a fresh perspective could bring about necessary reforms? Let us know what you think.